Hi, thank you for taking the time to watch this video. Following this is a conversation that we had with Brian Goldtree, who is a pulmonary intensive care specialist at St. Luke's. There was a lot of misinformation and a lot of lack of information in the market, and certainly within our company. And we really did this discussion to try to tackle some of that and to tackle some of the vaccine hesitancy that we saw out there. So for Hayden Beverage people who are watching this, thank you for taking the time. Please consider this. If you haven't gotten vaccinated, I hope this helps you cross that hurdle. And if you have, hopefully will help support you in your discussions with others. For business leaders outside of Hayden Beverage, I hope that this can be of help to you somehow with you and your companies as we try to get our vaccination rates up across Idaho. Thank you. Let me jump in on the vaccination. Why are we having a kind of all company call to talk about vaccinations? Because if you're watching the news at all, you realize that this stuff is getting real. Idaho's ICUs are getting packed. I understand that in Boise, that St. Al's has created a second floor for their ICU because it's so crowded. I've heard that some of the St. Luke's ICUs are full. You hear horror stories in other states. And I heard today on the news we had the largest number of new cases since COVID began. I think we had 1,000 cases today and 7 deaths, from yesterday. And that's the biggest thing, I think, is that people are dying. We had 2 of our coworkers' dads died in the last 2 weeks. One of them 47 years old. Neither of them were vaccinated. 2 deaths that probably could have been avoided had they been vaccinated. I know that there's a lot of people on this call who aren't vaccinated. And while the country is tearing themselves apart over this issue, I really hope that we can come together as a company on this issue. I'm going to ask you to get vaccinated. I'm not going to tell you to get vaccinated. One of our values is respect, and respect is to treat others the way you'd expect to be treated. And no one likes to be told what to do. I'm not going to command you to get respected or to get vaccinated, but I'm going to ask you to get vaccinated. And I'm going to try to sell you on getting vaccinated today. So if you're not vaccinated or you're opposed to vaccination, I ask you to keep an open mind. If you are vaccinated and you believe in vaccinations, hopefully the things we talk about today will be helpful in your conversations with others. So I guess first of all, features and benefits, why should you get vaccinated? I think at the very core, vaccinations reduce infections and cases, and less cases mean less transmissions. Less transmissions mean reduced chances of more variants, and less variants mean hopefully we get to eradication and we get to going back to life as normal. Right? That's the very basics of it. I think there's 5 or 6 other reasons that I think make sense to get vaccinated. The first, from a Hayden Beverage level, is operational. When somebody is positive with COVID, then it takes them out of our workforce, and it takes the people that they've been around out of their workforce. And so a positive case has the potential to shut down a portion of our company. We saw that happen last year with Dawson Taylor, when we had 3 or 4 baristas out and we had to shut down and diminish the hours of our cafes. Easily you could have Lewiston or Bozeman or entire market shut down from COVID. So that's one reason to get the vaccine. Another reason is financial. Last year there was federal support. If you got COVID, you could stay home and the government would continue to pay your wage. That's gone, right? So now you have to use your PTO or go unpaid. And if that wasn't financially scary enough, if you go to the ICU, the cost can be incredibly high. I had a conversation yesterday with Ted Challenger, who's a customer of ours. He owns several bars in Boise. He had COVID last year, was in the ICU for 3 weeks. His total COVID medical expenses were $800,000. When I see somebody get in real trouble in our company, it's usually because of something medical. It's usually because they had to come out of, had to do their full out of pocket, they maybe even had more expenses, and it just puts them into a hole that gets deeper and deeper and deeper. I don't want that to happen to any of you or any of our people. So again, that's another reason to get vaccinated. Next is math. To my understanding of what I've researched, the chances of vaccination killing you are 2/1000% to 5/1000%. The chances of COVID killing you are between 1.2 and 2%. Without moving my decimal points, I think that means COVID is about 1,000 times more dangerous and deadly than the vaccine. Another reason to get vaccinated. And then there's just, I think, a simple logic. If you get COVID and end up in an ICU, or if you have a heart attack, or any of those things, you trust the doctors to take care of you. And if you trust the doctors to take care of you when you're sick, shouldn't you trust the doctor to tell you whether or not you should get the vaccine? And I know a lot of people are not listening to their doctors who are telling them to get the vaccine. My neurologist, my family doc, every doctor I've talked to has recommended for me to get a vaccine. Next is moral. I think that that morality is when we do things that don't harm each other in a community, and that's what allows a community to function. Not getting vaccinated and then putting other people at risk, or filling ICUs to the point that somebody who has a heart attack or other emergency can't get care. That is immoral, right? And so I think that's another reason to get a vaccine. And lastly, I think is emotional. I would hate to think how awful it would be and how heavy the guilt would be if I had COVID because I didn't get a vaccination and I passed it to somebody who died, or I passed it to somebody who passed it to their parent who died, or passed it to their kid who died. That would be something that would stay with you for the rest of your life. So again, it seems to me there are so many good things that can come from a vaccine, and there are so few bad things that I ask again for you to get vaccinated. Now, I've spoken to a lot of people, not a lot of people, I've spoken to several people over the last week or so, and it's been really good for me to hear why people were opposed to getting the vaccine. And I think that really helped me to get their perspective. I think it really helped them to talk about it. And in several cases, within the next few days, they got vaccinated. And not because I came up with so many answers, but I think it was just having them talk through it. And there's a lot of misinformation out there from the internet, from Facebook, from the media, from both extremes. There's a lot of bad stuff out there. And part of professionalism, one of our core values, is knowledge, right? Is making good decisions based on good knowledge. So what I'd like to do right now is bring up somebody who kind of represents that knowledge. His name is Dr. Brian Goltry. He is my sister's husband. He is a pulmonary intensive care specialist, so he was very much on the front lines of this stuff. He's an active on the medical staff at St. Luke's. He's a clinical instructor at University of Washington. He's been a pulmonologist for 20 years, and he has a way of explaining some of these things to me and my kids and my wife that seem to be better than anybody I've come across. So I've asked him to talk a little bit about about his experience with COVID and the vaccine, and about the vaccine and its goods and bads, and maybe some of the myths, and the effect of patients and the system of COVID. I want he's here to answer questions as well. So if you have questions, please put them in the chat. If you're opposed to getting the vaccine, please write down what your opposition is, and in hopes that we can discuss that. So with that, Brian Goltry, thank you so much for taking your time to talk with the Hayden Beverage team. You got 334. Actually, you've got 666 ears.
Thanks, Dodds. And thanks for allowing me to talk to your team. I think your statistics are pretty accurate. Thanks for getting current on those. And thanks everyone for being here who's on. And this is, I want to make sure this is a safe environment just to answer questions. And I tried to think about the best way to do this. And Dodds and I had talked about doing this last week. And a lot of things have changed in my life since then, and how I kind of put this together. And I thought what I might try to do is just kind of explain the science of the vaccine, just very simple, because it actually is pretty simple when you look at it at a macroscopic level and not a microscopic level. And then I polled many of my colleagues that I work with and got some expert opinions from some of our infectious disease and rheumatology providers that I work with, and kind of told a total of questions that people ask them quite often about the vaccine and some of the myths that are out there. And maybe I'll probably answer many questions, but after this, we can always, go to the chat and talk about some of that and any other questions you may have. But real quick, just the science of the vaccines. Many of you probably already know some of this. There's obviously 3 vaccines that are out there, 2 that are called messenger RNA vaccines, and then another one that's called a viral vector vaccine. And the messenger RNA vaccines, they are designed in a laboratory, and the messenger RNA is very similar to the messenger RNA that you have in your own bodies. And basically, kind of in simplified terms, what messenger RNA does, it's kind of a recipe. And we make that in our body right now to make proteins and receptors and things like that throughout our body to make it function normally. And these are just recipes to do that. There's machinery inside of our cells that use that messenger RNA to create these proteins. Well, that's what we're basically giving the cell, is this messenger RNA. And the messenger RNA is carried by these small little particles called nanoparticles, and they go into the cell, and the messenger RNA is dropped off into the cell, not inside the nucleus, just inside the body of the cell. And this machinery in the cell reads that messenger RNA, and it basically just produces these little spike proteins. It doesn't produce the virus. It just produces these little receptors that are very consistent on all the coronaviruses. And it's the one common, consistent protein on this virus that we can attack. And then that virus just attaches to our cells. We create antibodies to it. And now we have antibodies that are neutralizing antibodies to the infection, and that RNA just gets dissolved. It does not get incorporated into our cells. And just by the science of it, it's not designed that way. It can't do that. So the messenger RNA goes away after the vaccine does its effect. The other type of viral vaccine, it's called an adenovector, which is the Johnson & Johnson vaccine, which you guys have probably heard of. The other 2 are the Pfizer and Moderna. The Johnson & Johnson vaccine uses an inactivated or a virus that cannot replicate. It's a type of virus called an adenovirus. And they've actually genetically modified it to have these little spike receptors on it, just like the coronavirus does. And they inject this into our body. The virus can't replicate. It's not designed that way. And we develop antibodies to these spike proteins, and then we have neutralizing antibodies to the virus. So these types of vaccines are very simple, relatively speaking, at the macroscopic level. And they've actually been around longer than you think. It's just they came to press when coronavirus came out, and vaccines like this were already being developed because they actually are safer than previous vaccines. The vaccines are not made with latex, they're not made with egg products or food products, quinine, things like that people normally have allergies to. Some people, there are contraindications to getting certain vaccines. They're made with eggs, animal products, things like that. They don't have any food additives or preservatives in them. So having an allergic reaction is relatively uncommon. And they're probably some of the most efficacious vaccines we've developed. When they first came out against the alpha variant of the virus, they were 95% effective for the mRNA vaccines and upwards of 70% effective for the Johnson & Johnson vaccine. So one big concern that's come out is these vaccines were rushed. And try to understand that over 350 million doses of these vaccines have already been given. And this includes the booster dose for the mRNA vaccines. And just because these vaccines are emergency use authorized, it does not mean they're being critiqued and studied diligently. These vaccines, to get EUA approval, have gone through phase 3 trials, which includes safety and efficacy. And it gets to a point based on statistical analysis that the benefit of these vaccines soon outweigh the potential risks of them without having full, complete data over years or months. And that's when the EUA comes into play. They're still evaluating these viruses. Other studies are being done, but these vaccines have been studied in thousands and thousands of people, which does not include the 350 million doses that have been given to the general public and are deemed extremely safe. And as you know now, the Pfizer vaccine has been FDA approved for ages 16 and older. And booster vaccines are also recommended for those that are immunosuppressed now. The Moderna vaccine will probably get FDA approval within the next month for ages 12 and older. And we're hopeful that the studies on children 2 and older will be out by the end of the year. So much more to come on that. But now the Pfizer vaccine is FDA approved. Doesn't change how it's still evaluated though. There's very few side effects with these vaccines. The most common side effect that you would receive with any vaccine includes maybe a sore arm. You may get a rash. You've probably seen those. You may have a fever. You may have chills, body aches. It does not mean you have the infection. What it actually means is your body is mounting an appropriate response to the vaccine. You may have no symptoms at all. It doesn't mean you're not mounting a response to the vaccine, but that's all that it tells you, is that you're actually just having an immune response, which you want to have. So those side effects are common, and they are very short-lived, usually less than 1 to 2 days. They can be a little more severe or intense with the booster vaccine, but not in everybody. There are some rare side effects with the vaccine. Anaphylaxis, you see a lot in the press. You can get anaphylaxis with anything. Anaphylaxis is an inflammatory or allergic reaction that people can receive or have when they receive certain types of drugs, if they have a food allergy, things like that, vaccines. It doesn't mean that anaphylaxis is unique to this vaccine. You can just see it, of course. And usually that happens very shortly after you've received the first vaccine, within 30 minutes. That is why most people who get the vaccine, they wait in the doctor's office for 15 to 30 minutes before they go home to make sure they don't have that reaction. And if they do, it is very treatable. So that's a reversible side effect that we do see. You probably heard other side effects like blood clots that form, what we call vaccine-initiated thrombotic thrombocytopenia, or VIT, as it's called. It's associated with the adenovector virus or the Johnson & Johnson virus. That's a very, very rare side effect of that vaccine. We've seen it mostly in women under the age of 50. And actually, they took that vaccine off the market, if you remember correctly, to do more studies on it and evaluate it further, and realize that that side effect is so rare compared to the benefit that it provides that now it's back on the market again after further study. So it doesn't mean it's contraindicated. The other type serious side effect that you've probably heard about recently in the press is myocarditis, inflammation of the heart, inflammation of the lining of the heart. Also extremely rare complication. Less than 7 people out of 1 million have ever had that complication. It's usually short-lived. Sometimes we treat it with steroids or other immunosuppressive medications. Rarely people ever come into the hospital. They just deal with it at home and the side effects go away. So those are probably the most severe side effects that we see with COVID vaccine. But now, one concern we have is we don't know how long this immunity is going to last from the vaccines. I think eventually, I'm speculating, but boosters are going to be requested or ask you to take boosters to improve your immunity as the immunity wanes over time. More science will tell as time goes by. So that's still up in the air at this point as far as, are we one and done? We don't know the answer to that yet, to be transparent with you. Vaccines are not 100% effective. No vaccine is. And these vaccines, when they first came out against the first virus variant or the Alpha variant, the mRNA vaccines were 90 to 95% effective. The Johnson & Johnson vaccine was about 70% effective in preventing disease, but still we see some people that get breakthrough disease. We do see a little more disease breakthrough with vaccines now with the Delta variant, which is shown to be more contagious, more virulent than the old Alpha variant. So we do see those, but it's highly unlikely that you will actually get a severe infection. And what I mean by severe is just an infection that makes you sick enough to go into the hospital, not necessarily wind up in the ICU. Right now, these statistics are sad. In just St. Luke's health system alone, we have over 200 patients in our health system at St. Luke's only that have COVID, that's severe COVID, meaning that they're in the hospital. It's gone up from 20 less than a month ago. And these people are people of all ages 20 to 80. We have a pregnant lady. We've had we've had a few pregnant people. We've had children, and all these age groups, demographics, races are increasing exponentially. And right now we have accessory ICUs that are open to deal with these patients. I was in the ICU last week and I had to accept a patient from Oklahoma because they didn't have enough ICU beds between here and the Chickasaw Nation in Oklahoma. So it's a very serious problem that we have here that's just not being advertised in the press enough. I want to kind of conclude some of this with just answering or addressing some very common questions that we hear from families about, some myths or just questions about the vaccine that they may see on social media, certain types of news broadcasts. And I think it's important to try to explain those better. And I think we've done a poor job of doing that. And that's on us not to come out and do that better. So one question that comes up or that I hear quite often, and my colleagues hear quite often, is that, well, I'm just going to wait to get herd immunity. I'm not going to get a vaccine. I'm just going to wait until we have herd immunity so everyone just gets infected and then we're all good. There are an awful lot of some assumptions with herd immunity, an awful lot of assumptions. And without a robust vaccination policy, it is very unlikely we will ever get herd immunity. And the farther we get out from this and the more variants that are out there, the less likely we'll ever have herd immunity. We don't have herd immunity against the common cold. Same thing can happen with this virus. 70 to 90% of people that I've reviewed ultimately will need to have COVID antibodies. And people who actually get infections, their immune response is really variable. And we've actually seen people get second infections after being infected the first time. You cannot predict the immune response that you will get from an infection. We think they get a stronger immune response the more severe disease they have. But do we have to have severe disease in order to get an immune response? That can be dangerous for them and others. The vaccine actually provides a more consistent immune response. And that's been shown in tens of thousands of people that have received this vaccine. And they create something called neutralizing antibodies. And these antibodies attack a very common area of the virus called the spike protein that is consistent on all viral particles. And it prevents it from attaching to cells and entering our cells. So to say that we're going to have herd immunity, we'll just wait for that is actually pretty unlikely. And even if we did, it's going to take years to do that with millions of people dying, with economic shutdowns. And if you wait to get infected, making the assumption that, well, I'll just get infected and I'll be fine, the chances of me getting severe disease are very low. That is correct. However, the morbidity from this disease is extremely high. And I'm talking about 30 to 50% of people who get COVID, all severities of it, can have long-term complications, loss of taste and smell. They can have what you probably heard of brain fog that they can experience, confusion, they don't think as sharp. They can have chronic fatigue, debilitating fatigue. They can have unusual chronic pain symptoms. These are just to name a few of the long-term side effects that we're seeing in these people that either have or don't have a serious infection. So waiting for herd immunity to occur, number one, it probably won't, and number two, it can be very dangerous. Other questions that I've heard, I don't want to get vaccinated, this is my decision, and I'm the only one who suffers the consequences. Well, I hear that a lot, and I do understand that. I think that probably is more of a political statement than it is a public health statement. That's strictly my opinion. But what you have to realize is that without being vaccinated, you're not only at higher risk of getting disease, but you're also at higher risk of transmitting disease or transmitting virus. Like I mentioned before, we are seeing more unvaccinated people in the hospital getting sick more than once. Okay, it just doesn't happen once, and it doesn't look like this is a one-off opportunity that happens. When the virus spreads, the more it spreads, the more chances it has to mutate. And when the virus mutates, they become more dangerous, more virulent, more contagious. And we are clearly seeing that with the Delta variant. And we're seeing younger people as well as old people get sick. We're seeing children, we're seeing pregnant moms get sick. So the more it spreads, the more it's going to change, and the more likely it's going to stay with us forever. Other issues with that, if you think about this health crisis that we've had, This is the first international health crisis we have had in over 100 years since the Spanish flu. And probably the only reason the Spanish flu didn't go out of control was because our travel is a lot different now. International travel, we have a global economy now. So it's much, much different. But when you think about risk with this, don't think about individual risk. This is really collective risk. It is no longer about the individual, because in order for you to be safe, you have to keep others safe, just to put it plainly. The vaccine, other questions I've heard, the vaccine is not safe. Well, I think I've already probably addressed that. And we've talked about the emergency use authorization and FDA approval. Just because it has EUA approval doesn't mean it hasn't gone through phase 3 clinical trials. You reach a statistical point in the setting of a public health emergency where you finally say the benefits of giving this vaccine outweigh the potential risks. And now that we're 8 months out, with most side effects of vaccines occurring within 8 weeks, that now the Pfizer vaccine has been FDA approved, and we anticipate the Moderna vaccine will be FDA approved. If you think about viruses in general, and you think about natural immunity versus what we've created in science, I guess, to enhance our immune system, why we don't have smallpox anymore, why we didn't have measles or mumps anymore for a long time, typhoid, polio. It's not because of our own immunity. It's because herd immunity was created with vaccines. Other questions I've heard, this is a common one, and I think a very appropriate question. I've already had COVID, so I don't need to have the vaccine. Well, I mentioned before, people are getting reinfected, even though they've had COVID, even though they've had serious disease before. Lasting immunity from an infection has not been proven, and we have been able to show antibody analysis in people that have been infected. Their level of immunity is extremely variable and difficult to predict, as opposed to getting the vaccine. The antibodies that you may develop may not be neutralizing antibodies, depending on how much vaccine or virus inoculum you receive. So to say that you've had COVID, so you need to get the vaccine, actually that's not true. You can still get infected, you can still get serious infection, and you can get infected by one of the more deadly variants. And these vaccines have shown, albeit a little more decline, but they have shown significant efficacy in the variants, including the Delta variant. Other questions I've heard, I am young and healthy, and it is unlikely I will get sick, so I will not get the vaccine. Well, I mentioned before, we're seeing kids now, and we're seeing pregnant women, people in their 20s to 80s, and not by getting the vaccine, you're not only decreasing your risk for getting infected, but also transmitting the disease, like I mentioned. So even though, yes, if you're young, if you're well, your chances of getting really sick are very low, but you can also transmit the disease for days, even in the setting of being asymptomatic, which is one of the problems that got this virus off in the first place when it first came out last March. And then don't forget, I mentioned before, that even though you don't really get sick, the long-term complications that can happen, regardless of the severity of your illness. That probably has been more of an impact and will be more of a health crisis in the next 12 months when we see these long COVID patients. I have an autoimmune disorder, therefore I should not get vaccinated. Actually, there has been good data looking at that, and good data that's been accumulated. And thus far, people with autoimmune disease do not seem to express any increased autoimmune activity to those that have received placebo. So actually, people with autoimmune disease, it is recommended that they receive the vaccine. For women under the age of 50, they should probably not get the Johnson & Johnson vaccine because of the small but real risk of developing blood clots that can be life-threatening, even though it is rare. Obviously, anaphylaxis to vaccines can happen, that I mentioned before, but just because you have an autoimmune disorder does not mean that you actually can't get the vaccine. And even though you've had anaphylaxis in the past, talk to your doctor, because that's not an absolute contraindication to getting the vaccine either. Probably the biggest thing with autoimmune disease is receiving immunosuppressant medications. And people who actually receive immunosuppressant medications, there is concern, like if they have rheumatoid arthritis or scleroderma, some of these other diseases require steroids, or some of the other immunosuppressant medications, that they don't have a robust enough immune response even after the second booster vaccine. And now it's being recommended they get a third booster for those that have received previously the messenger RNA vaccine, not the one-off Johnson & Johnson. So sometimes the timing needs to be discussed with your rheumatologist. Certain people receive long-term or long-acting immunosuppressant medications, injectable drugs, and it's important to kind of time your vaccination so you get the most robust immune response to it. But immunosuppressed people or people with autoimmune disease definitely can get vaccinated, and it's recommended. And actually in women, the American College of obstetricians and gynecologists recommend that pregnant people do get vaccinated. Let's see, the vaccine will give me COVID. That won't happen because we don't inject you with COVID. We inject you with the RNA that creates just the spike protein. It doesn't create virus. And the Johnson & Johnson vaccine is not COVID either. It is an inactive and a virus that does not replicate, that is an adenovirus that just displays the spike protein, and we develop antibodies to it. It's relatively straightforward. The vaccine will negatively impact my fertility. Very good question. And there is no scientific basis for this in regards to the messenger RNA vaccines. It won't affect fertility. And once again, it actually is recommended by the American College of Obstetrics and Gynecology to get the vaccine if you are a woman and if you're pregnant or if you're lactating, you should get the vaccine. The COVID vaccine can cause Guillain-Barré syndrome. That is a good question. It does not cause Guillain-Barré syndrome. It hasn't been reported in any of the clinical trials regarding the 2 messenger RNA vaccines as of yet. And actually, Guillain-Barré is a complication that we actually see in people that get viral infections. And actually, any virus can cause that, and viruses are much more common to cause Guillain-Barré than a vaccine. So keep that in mind. You're more at risk for getting Guillain-Barré and this kind of diffuse paralysis disease than you are from a vaccine. I think I already answered this. I am pregnant, or I want to get pregnant, therefore I should not get the vaccine. Once again, American College of Obstetricians and Gynecologists recommend getting the vaccine, whether you're pregnant, whether you're lactating and breastfeeding, or whether you plan to get pregnant. And actually, over 120,000 pregnant females have been vaccinated in the United States so far, and they all enroll in this monitoring program called V-Safe. Maybe you've heard of that if some of you have gotten your vaccines at St. Luke's, where they report side effects that they have. And thus far, they have not had any side effects other than what I've mentioned as far as the minor ones. So a population of over 120,000 people. So in conclusion, I want to finish with one thing, and Dodge, you didn't ask me to do this, but I'm going to do it, is the issue of masks. Just real quick, I know there is probably more misinformation about mask wearing and social distancing than anything else. First of all, did people realize that we didn't have a flu season last fall? First time in recorded history over the last 2 decades, we have not had a flu season, or actually a cold and flu season. And that is related to masks and social distancing. The way masks works, and this is the misunderstanding of them, and I'll give you an example or a scenario to explain it. It's probably the easiest way to do it. If I have COVID and I walk into a room, or any virus, and I'm wearing a mask, and I walk into a room with 10 people, I am helping you, okay? And I am helping you by wearing a mask, and I'm decreasing your infection risk by 50%, if not more, closer probably to 60%. Now, if I walk into a room and I'm wearing a mask and you're wearing a mask, and one of us has COVID or some other virus, we cut that transmission risk down to 20%. And that is proven by droplet analysis that we have done with masks. The key with wearing masks is that everyone needs to wear them. I mean, if I'm wearing a mask and I don't have COVID, but somebody else is next to me and they have COVID, I'm not really helping myself a whole lot. Okay, and I'm the first one to admit that. My mask is probably not being very effective. They're breathing on me, they're coughing on me, I'm self-inoculating myself by touching my mask and rubbing my nose, and it's getting around and things like that. But if we're both wearing masks, our transmission risk goes down to 20%. And now add 6 feet of distance into that. Masks do work, but we all have to wear them. That's how they work. I go to a grocery store and I'm the only guy wearing a mask, I'm helping everybody else, but they're really not helping me. It's more just setting an example. So masks do work when we're compliant with them and we wear them over our nose and mouth, just not one or the other. And when you get a mask, best thing to do is get one that has 2 layers of it, fiber layers. Rule of thumb is if you look up at the light and you can't see light through it, that's a good mask. You should be able to breathe through it. It shouldn't have those valves on them. Those valves are one-way valves, meaning that you can exhale through them, but when you inhale, you don't inhale any, it's filtered. So once again, you're still exhaling out and you're not helping me with those valve masks. So those valve masks actually don't work if you have an infection. So in last, I want to appeal to you to get your vaccine, to continue to ask questions. Okay, continue to ask these questions. They're all good questions. These vaccines are newer, but they have been studied significantly. Just because we have different technology that actually is safer than injecting people with live viruses or viruses that are inhibited where they can shed virus after they've received a vaccine, just because the technology is newer doesn't mean it's flawed. And one of the reasons why I'm off today and not working right now is that my dad died of COVID last night in the hospital at St. Al's. And he didn't need to. He didn't get his vaccine. He was 85. He was a physician. He had his views, and I understand those. It was a choice. But this is your choice as well. And this is about our community. And it's about community risk and mitigating that risk. It's not about individuality. This is really a public health issue. And we can get through this, but the longer we wait, the less likely this will ever go away, because herd immunity is not going to happen. I can go to the chat. If anyone has any questions, I'll turn that on. Dodds, I know I went over. I want to thank you for allowing me to speak to your team. Thanks for all you guys do. I love Hayden Beverage, not just because I love IPAs. I appreciate all you guys do for the community, and especially Camp Rainbow Gold. I appreciate what you guys do for Camp Rainbow Gold. Thanks a lot.
Well, obviously, so sorry to hear about your father. And as you probably heard earlier, we've had several. I mean, I can think of 5 people who have lost a parent to COVID since COVID started just in our company. And I'd love to do nothing more than stop that by getting these vaccinations up. So I've heard a couple times about doctors not getting COVID. Your dad didn't get it. I know that now St. Luke's, my barber the other day was telling me that he had to get a new doctor because his doctor was fired by one of the doctor that was the doc in the box. Anyway, yeah, one of the urgent care clinics that they're fired because of their mandate. Why are their doctors not getting the vaccine?
Well, that's a really good question, and I think it's what it's become, and some of this is speculation, and also interacting with doctors that haven't been vaccinated, is that it really has become polarized and political because of that. I mean, the science is pretty sound. It really is sound. It depends on where you get your science, and not all science is science. There's a lot of social media outlets that are out there that are politically skewed one direction or the other. I'm not in favor of either of them. But the science is sound. And I think it comes to the point where you do make a political and individual statement. And I completely understand that. And I think that's why a lot of the physicians and nursing staff that have chosen not to get it have chosen it because it's their right and they don't want to be told what to do. And I get it. But when you look at this at the big picture, this is a common enemy that we have. This is a time of war. And if we're all told to have blackout so we don't get bombed, and one person decides they're not going to because it's their right, even though the science is sound, there is an ethical responsibility I think we all have there. So that's all I can say. The science is sound. I don't think they're scared of, I think, as a political statement. And some actually believe that it's not that dangerous. And many of those people that you see, they don't work in the hospital like I do. They don't see what I do. They don't see the isolation. They don't see their parents sitting alone in their rooms and not being able to see family and being short of breath. being confused, delirious, winding up on a ventilator, being paralyzed, being prone on their stomach, and having a tube in their throat and being heavily sedated, and then having disability after that, 6 months, if not permanently, and maybe even winding up in a nursing home, even though they were living independently before they ever got sick. That's what they don't see.
On the booster, if somebody got a second shot, back in February, when are they allowed? When can they get the booster? And is the booster the same? Like if I got the Pfizer shot or the Moderna shot, is the booster the same shot? How does the booster work?
The boosters right now are not FDA approved. They are EUA approved right now and recommended for those that are immunosuppressed. And so right now there aren't boosters available for those that otherwise have normal immune systems. I think that's coming though. And they recommend getting a booster with the same vaccine that you received previously. So if you had the Moderna, you get the Moderna. If you had the Pfizer, you get the Pfizer. Obviously, if it was an extreme of time that they would consider mixing those, and they did that when the vaccines first came out. But the recommendation is if we are going to get boosters, we try to get them within 8 months of our last shot. But that is still being looked at. So that is only approved right now for those that are immunosuppressed. And that happens, I believe, the first September 1st, when people can get their boosters if they meet standards for being immunosuppressed.
Where can I go to get vaccinated? I believe almost any pharmacy has vaccinations. I know Albertsons, Walmart, Walgreens, Rite Aid. Everybody's got pharmacies, correct?
Yeah, and they will guide you in the direction if they don't have what you need. And once again, pay attention to the restrictions, like on the Johnson & Johnson vaccine. If you're female and young, you should probably not get that vaccine, just based out of caution. But you can also call 208-381-9500, which is the St. Luke's COVID hotline, and they can steer you in the right direction. You can also schedule it if you're a St. Luke's patient through your MyChart account. You can get on there and you can schedule a vaccine appointment. And then when you get your vaccine, depending on what type you get, which would probably be the messenger RNA vaccine, one of the two, then at that time, when you get your first one, they would schedule your second one. And I can't emphasize enough, if it's a 2 vaccine dose, if you haven't gotten it yet, if it's a 2 vaccine dose with the booster, it is so important to get that booster. Don't stop after the first vaccine, because the efficacy has been looked at 1 versus 2, and that's why they have 2. The efficacy is about 50% after the first one. It goes to 90% after the second one. So it is imperative that you do complete the cycle. Is it okay if I go through this chat real quick?
Sure.
So let's see. First one is more likely that unvaccinated people spread virus because they are more likely to be asymptomatic. I think you could argue that. Yeah, I think even vaccinated people can still spread virus. And that's why vaccinated people do need to wear masks when they're right now, at least in our high transmission setting in Idaho, the vaccine rate is only about 50%. Actually, I think it's just below that. It may have changed the first part of this week, but it was 46% at the end of last week. So vaccinated and unvaccinated people can shed virus and they can be asymptomatic. So if you're in a high prevalence area like Idaho, then you probably should wear a mask, because you can spread virus even if you're asymptomatic. Approximately what percent of admitted COVID patients at St. Luke's are unvaccinated? 98%. And the only vaccinated patient that I've seen and my colleagues have seen in the ICU was someone that was immunosuppressed. So the timing of their vaccine probably wasn't appropriate, or they're just immunosuppressed and they're going to get sick and they probably got a big inoculum. But right now, it is safe to say that all we're seeing is unvaccinated people in the hospital, and they are critically ill. Reports state cloth masks are 10% effective and less effective if they get moist, as happens when engaging in physical demanding work. There are athletic masks. There are also surgical masks you can get that combat the moisture. You are correct. If they get soiled or they get moist, they will not work as well. That is correct. If you are outside and working aggressively, you don't necessarily have to wear a mask if you're socially distancing. The same thing could be said inside potentially. If you were really social distanced and it's in a good ventilated area. But the rule of thumb is, if you look at a mask, this is an athletic mask, right? It's an athletic mask you can wear, and it should cover your nose and your mouth. And if it's fabric like this one, you want it to be at least 2 layers. Okay, this one actually is 3 layers, and it's made out of breathable fabric. So you can breathe in. I mean, you can get hot, obviously, but you're going to breathe in. Hold it up to a light, and if you can't see through it, and you can breathe comfortably through it, and it has a cramp on the nose, so it can cramp over your nose and prevent as much air from going out as possible, that's a good mask. That's an effective mask. Are vaccines ethically made? That is a very good question. And those questions have come up, I think, if I'm answering this correctly, in response to using fetal tissue. We do not use fetal tissue to create these vaccines. We do use fetal cells, for example, in I think it's the Johnson & Johnson vaccine, to create them. These fetal cells are not the same as fetal tissue. And these are generations. There's a 1,000 generation gap between these fetal cells and any fetal tissue. And these fetal cells, the reason why they like to use them is because it resembles human cells, obviously. And these are viruses that attack humans. So they're able to test vaccines and develop vaccines most efficiently, as far as certain types of vaccines, in these fetal cells. It's not fetal tissue. And the messenger RNA vaccines, they don't use fetal cells or fetal tissue. But fetal tissue, I think your question is great. Ethically, yes, these vaccines are ethically made. What percent of vaccinated people get Delta versus unvaccinated? Both can get it. And the thing about getting Delta, if you're vaccinated, it's much less likely you will get severe disease. And just by severe, I mean being admitted to the hospital, even though maybe you're on a couple liters of oxygen. But people who are unvaccinated right now, like I mentioned before, almost everybody in the hospital is unvaccinated that's there right now. And that's not out in the press, and it's too bad, in Idaho at least, because it needs to be, because that's what we're seeing. So if you are vaccinated, you can feel relatively safe. Doesn't mean you shouldn't take precautions, especially decreasing the community risk and transferring virus to other people. You're doing others a favor by like wearing a mask and social distancing still when you're in public areas, but your safety profile is much better than someone who's unvaccinated against the Delta variant. Is it safe for kids too young to get the vaccine to go to school? Right now, the vaccine is only for those ages 16 and older, as far as full FDA approval, but for an emergency use authorization, you have to be at least 12 years old. So we are not giving the vaccine to those under the age of 12 yet. I think that data will be compiled in print by the end of this year. So by the beginning of 2022, hopefully ages 2 and older will be getting the vaccine. Are the vaccines administered today the same as 6 months ago, or are they continually being developed? They're administered the same. They're not developing new types of vaccines per se, but they obviously are looking at these variants and testing the efficacy of the current vaccines. And if the efficacy is not there, then they'll be prompted to change it. So that's being looked at constantly. Good question. Everyone does everything right from here on out. What does normal life look like several years out? That is a good question. We are running out of time. And if we don't establish herd immunity, and like I said, the chances of establishing herd immunity is extremely unlikely without a vaccine. And that has been shown with other vaccines, including polio, including smallpox. Herd immunity, as far as not seeing this infection again, is very unlikely with natural immunity. So if we do everything right, and we do everything right now, we have a chance to squash this. And I'm being sincere about that. We have a chance to squash this or isolate it so quickly that it can't spread. If it shows up in small communities, if it shows up overseas, we can combat that much quicker than we can a pandemic. So I think there is a definite chance to get back to normal. But if we don't get vaccinated, I am not very hopeful. Are there legitimate concerns about long-term safety of vaccines? Have there been other vaccines that have had harmful effects that surfaced only years later? The last part of this question is surfaced years later. There's been, rumors about autism, about Guillain-Barré, like we mentioned. Those side effects are so extremely rare. The autism, there hasn't been good data to support that. I'm just going to stop that right there. But I guess the answer to that question is probably no. I know that sounds really wishy-washy. But right now, the safety of these vaccines, if you look at the side effect profile of vaccines, because you get the flu shot, those who get it, they get it every year, right? And it's a different mixture, different formulation of proteins and antigens of the virus that we think is going to cause the flu that year. Most side effects of vaccines occur within 8 weeks of receiving it. And actually, the vast majority occur within 3 weeks of receiving it. So to answer your question, yeah, there are long-term studies. And I think that months out is a long-term study, especially when you look at the science behind the vaccine and how it was made. These vaccines, like the messenger RNA vaccines, they're not designed to be incorporated into our cells. It's scientifically impossible because messenger RNA is designed in our bodies to dissolve after it's used. You cut off both ends and it just dissipates. This is the same thing. So scientifically, it's impossible. It goes away. There's just a couple more that I'll let you guys go. I know it's getting late. Can I donate blood after getting the vaccine? Yes. Under what circumstances would you advise someone to wait to get vaccinated? The only circumstances that you should wait to get vaccinated is if you're sick. You should not get vaccinated if you have an acute illness, whatever virus it is, but you shouldn't get vaccinated when you are sick. Some people are getting vaccinated within 2 weeks after they've had COVID. Definitely, I would not get the vaccine until you show consistent signs of improvement, recovering from COVID. But you could wait a period of time that's arbitrary, but there's no definite wait time after having COVID. Those that are immunosuppressed, that are receiving certain types of long-acting immunosuppression, like some of those injectables, you've probably heard of Rituxan and rituximab and some of these other methotrexate, drugs that last a long time. Sometimes you have to stop those, or you have to get your vaccine right before you actually receive your next dose of that long-acting injectable. So that's a time when you probably should wait, or try to minimize your immunosuppression so you have the most robust immune response you can to receiving it. Those that have actually had COVID and received certain types of antibodies, I can't pronounce it, but I'll call it bamlanivimab. There's some people who actually get COVID, they can receive a monoclonal antibody as an outpatient, and certain types of treatments that have helped to decrease the incidence of being admitted to the hospital. You should wait 90 days until that antibody goes away, or it'll just chew up the vaccine. But other than that, there's really very few situations where you should wait. I think you should always ask your doctor. And when you actually get it from the pharmacist, they have a whole typed out sheet of contraindications, which are extremely a small list, and when they should get the vaccine, and they can provide you with more education then. So very few circumstances. There's only one question left. How long do droplets stay in closed space if I'm working in my cubicle alone without a mask? That's a very good question. And if in the hospital, we have certain procedures called aerosolized procedures. Like, for example, people with COVID may receive a nebulizer treatment, or they're on a machine called BiPAP, like a mask that provides air pressure. So things are aerosolized pretty easily. After that aerosolized procedure is completed, we follow the data that we don't go into the room for 20 minutes. So if you base that on our experience in studies that have been performed in the hospital, when it's safe to enter a room, that there's a 20-minute period where these particles can stay aerosolized. So, once again, when you're in a closed space, and you don't know if everyone is vaccinated, which I think is kind of the big trigger on really, emphasizing a mask, not just for yourself, but for the person who's not vaccinated, because you could very well give them the virus. That when you're in a public space right now, in Idaho, in a high prevalence area, we should be wearing masks inside. I know it's not mandated. I know that it's been quiet in the news. I understand that. But I'm just telling you from a health risk perspective, given the prevalence of COVID in Idaho right now, if you were to walk into a room with 20 people, there's a high likelihood at least 2 are going to have COVID. That's a lot. So just think about that. I'm not trying to scare you. I mean, how hard is it to wear a mask? I know they can be uncomfortable. It sucks. I hate it. I wear N95s at work and you sweat and it's a pain. But when you're in those areas, especially if you're unvaccinated, it's probably safer for you to wear a mask than not wear a mask. And if you're vaccinated, you're just trying to prevent, potentially transmitting virus to others. So very good question. Another question was just put up. If I had COVID twice, is there a need to get the vaccine? Does the vaccine better develop one's immune response than it develops when having faced the actual virus? Very good question. And with the amount of data that's been accumulated over the last 18 months, it's incredible what we've actually learned just about viruses in general, is that there is a more robust immune response and consistent immune response to the vaccine than there is the virus. And that is probably exemplified by the fact that you've had COVID twice, okay? So people may not develop neutralizing antibodies when they get infected. They may not develop a very robust immune response when they get infected. And then if they get a huge inoculum of virus for the second, third, fourth time, they may get really sick and it may overpower their immune system. The vaccine has been shown to provide consistent immunity as far as the predictability of what your immune response will be. So the answer for you is, yeah, I think you should still get vaccinated.
If someone has Bell's palsy, would you still recommend the vaccine?
Yes, I would recommend the vaccine. The vaccine has not been shown to cause Bell's palsy. We think that Bell's palsy is caused by a virus and a reactivation of the virus. So vaccines are not shown to cause Bell's palsy. So good question, because Bell's palsy can be very debilitating, especially if it's a painful Bell's palsy. So there hasn't been any data to support that. One thing I want you to, and realize when you leave today is understand how viruses work. And we do not have a silver bullet for viruses. I mean, if you just think about HIV, that has not been cured. It's been treated. HIV has become a chronic disease, okay? The reason we don't treat viruses, they get inside our cells. They use our own cells' machinery to produce more virus, and then it kills the cell. So the best defense we have against a virus is to prevent infection, not to treat it. And the only way we really prevent infections with viruses, which has been shown with other viruses like polio, like smallpox, is to prevent disease and use or partner with our immune system. And that's what vaccines do. We're not going to have a silver bullet for this. Right? I know that ivermectin's out there. I know that hydroxychloroquine's out there, certain types of vitamins, certain types of protocols, that we've looked at extensively. There's data that's still evolving on ivermectin, but thus far it hasn't shown to be fruitful in this disease. Take home is we can't treat this disease. We don't have a treatment for it. We have some things that we can do in the ICU that may shorten the duration of disease, but it's not consistent. But I don't have a treatment. I do not. You see me in the ICU, that means it's trouble. I mean, it's going to be up to you. So please think about getting the vaccine. Please ask these excellent questions. Don't be fearful to ask questions. Don't be fearful to go against the grain, because it's not only your life, but it's others. This is community risk involvement. And the best way to fight this virus is to not get it. So thanks. Dodds, thanks again for having me. I appreciate sharing with your team, and be well, everybody. I'm going to go ahead and chime off. I have to run.
Thanks, Doc. That was the best COVID vaccine discussion that I have been involved with, and can't thank you enough. That was excellent. Thank you, everybody, for sticking around for an hour and 10 minutes. Again, an investment of an hour and 10 minutes, as opposed to losing your dad is an easy investment. So please get vaccinated. Help us get the rest of the company vaccinated. We got 600 people. We can make a difference. So go forth and conquer. See everybody.